Bonjour, professeur Esther DUFLO.
Hello, Professor
Bonjour,
Esther DUFLO. Hello,
Merci
sir.
de nous rejoindre. On est à la fin d'une longue et
Thank you
riche
for
journée
joining
ici
us.
au
This is
Cirque
the end
d'hiver,
of a very
qui par
long
ailleurs est un endroit que j'aime beaucoup pour
day in
amener
the Cirque
mes
d'hiver.
enfants
It's
voir
a
le
place
cirque.
I
Mais
like
aujourd'hui, on
very
va parler
much.
de
I usually
choses
bring my
plus
children here to
sérieuses.
watch
Esther DUFLO,
a
je ne vais
circus
pas lister tout
performance, but today we are
votre
doing something else.
curriculum
Esther
vitae.
DUFLO, I don't want to go through your
Économiste du
resume.
développement,
You're a
vous avez
development
été conseillère de
economist.
Barack Obama, vous
You
êtes
are
professeur
the
au
advisor
MIT,
for Barack
lauréate du
Obama.
prix
You
Nobel
are professor
d'économie
at
et de
MIT.
bien d'autres
You
distinctions
received the Nobel Prize
prestigieuses.
for in
Vous
the
avez
field of
fondé
economics
le
and a number of other
JAMEEL
awards.
Action Lab
You created the
à Boston.
Jameel Poverty
Il
Lab
s'agit donc
in
d'un
Boston.
laboratoire où
It's
vous
a
faites des
laboratory where
expérimentations.
you
Et ma première question
experiment. And my first question is
la méthodologie que vous utilisez pour
about
ces
the method you
expérimentations
use for
en
your
économie.
experiments in the field of economy.
Oui, bien sûr, la méthodologie va être, je pense, très familière
Well,
à
the
beaucoup
method is very
de vos
similar
auditeurs, puisque il s'agit
to
de
what
la même
many of our
méthodologie que celle qui est
listeners
utilisée pour les essais
do. It's
cliniques
the
en
same
médecine.
method that you use for
Donc, de la même
clinical
façon
trials in
que
medicine.
pour tester un nouveau vaccin ou un nouveau
When
médicament,
you
on prend
test
un
a new
échantillon
drug,
de gens,
a new vaccine,
on choisit au
you
hasard
take a sample of
un
people
groupe de
taken at
gens et un groupe
random.
reçoit, par exemple,
One group will
le statu
receive
quo, un groupe reçoit le
the
nouveau
current
médicament
drug, one group will receive
pourrait
the
le
new
remplacer,
drug,
et puis on
which
compare
could
les résultats
replace
dans les
it,
deux
and
groupes.
then we
Eh
compare
bien,
the
nous
results
faisons la
between
même
the two
chose,
arms
mais
of
pour des
the study.
interventions
Well, we
dans
do the
le
same thing,
domaine
except that
social, dans le domaine de
what we
lutte
do
contre la
applies
pauvreté,
to
entendu au sens large. Par
social
exemple,
issues,
si
the
on
fight
se
against
pose
poverty.
la question
For
non
instance,
plus de
if we ask ourselves
développer un nouveau vaccin contre le Covid, mais quel est le
whether
meilleur moyen de
what would be not
le
a
faire
new vaccine for
accepter,
COVID, but
on
what would be the best way
pourrait
to get this vaccine to be
essayer
accepted?
différentes méthodes,
We
par
try
exemple
and test several
différents
methods.
types de messages pour convaincre les gens
For instance, what
dans
kind of
différentes régions
message
et les
will
comparer
be
les unes aux
most
autres. Et
efficient
si ces
to
régions ont
convince
été
people
choisies
to
au
get
hasard,
themselves
eh bien, on
vaccinated?
peut s'assurer que
And we
c'est
choose
bien
the
l'effet
people
du
at
programme qu'on
random,
isole et
so
pas
we
quelque chose d'autre.
know that we're going
Alors qu'en
to
général, si c'est pas
isolate the
choisi au
effect of
hasard,
the program, and
régions ou les
nothing
personnes
else
qui
will be
décident
involved.
d'adopter
Whereas
telle ou telle politique ou
normally,
tel ou tel
people are not
programme
chosen
sont
at
aussi
random.
différents
People who decide to adopt this or
de
that
beaucoup
program or
d'autres
this or
manières.
that policy
Et du coup, on ne peut
are
pas vraiment
usually
isoler
different,
l'effet du
and
programme
there is a
lui-même
bias, and we cannot isolate
par
the
opposition à tous
effect
ces
of the
autres facteurs.
program itself
D'où
from the other
l'intérêt
factors.
de l'essai clinique
And this is
et
the
de
reason
l'expérimentation
why we
aléatoire dans le
conduct
domaine social autant que pour la
clinical
médecine.
trials to test
Est-ce que vous pouvez
this
nous
kind of
citer un
procedure
exemple concret,
like you would do it with a new drug.
que vous avez
Can
mis
you
en
give
place?
us a
Vous avez un
concrete
réseau
example of a
global,
study that you
avec
conducted?
lequel vous travaillez.
I know that you have
Et
a
plus
network you
particulièrement, alors
work
vous
with,
touchez plusieurs domaines
and I know that you work in several
des sciences sociales,
areas
mais peut-être plus
pertaining to social
particulièrement sur les
sciences,
questions de santé publique,
but possibly
sur lesquelles vous avez
public
travaillé.
health, because that is
Oui,
something you've been
donc
working
JPA, le
extensively
Jameel
on.
Poverty Action Lab, est
Yeah,
en fait
Jameel
plus un
Poverty Action
réseau qu'un
Lab is
laboratoire.
more a network
Aujourd'hui,
than
nous
a
sommes plus de
laboratory
1000 chercheurs
as such.
associés au
There
réseau
are
dans le monde
1,000
entier
researchers
et qui travaillent
connected with
toujours
the
en
network
collaboration
across the
avec
world,
des
but they
acteurs de
always
terrain,
work
que ce
in
soit des
collaboration
gouvernements,
with
des ONG, etc., pour
people
développer
on
des
the
programmes.
field,
Et
NGOs, etc., people
quand
developing programs.
la crise de Covid s'est
And when the
déclenchée,
COVID crisis
ça a conduit
started,
à une transition extrêmement rapide
it
a
led
été
to
nécessaire
a
puisque
very
beaucoup
quick
des interventions qui
transition.
étaient en route ont dû
The
s'arrêter
transition was needed
et
because
il
many
devenait indispensable d'avoir quelque chose
programs
à
which
dire
were
le
in
plus
progress
rapidement
had to
possible
be stopped,
sur comment
and so we needed something
persuader,
else
comment pouvoir aider les gens à adopter les comportements qui pouvaient
to
les
help
protéger
people
au début
adopt
de la
the
crise du
type of
Covid,
behavior that could
quand on
protect
n'avait pas
them.
encore de
At the very
vaccins
beginning of the COVID crisis, when there were no
ou de
vaccines
médicaments.
available
Donc, ce qu'on a
or
fait,
no
par
drugs.
exemple, d'abord en
So what
Inde,
we did was,
c'est
for
en
instance,
travaillant
in
avec le
India,
gouvernement du Bengale occidental,
working
un
with
des très gros
the
États
government of
à l'est de l'Inde.
Western Bengal, one of the
On a
main
choisi, on a
biggest states
divisé
in
donc
Western India.
l'État
We divided the state
en codes postaux. Il y a à peu
in
près
zip
un millier
codes.
de codes postaux
There are
au
approximately
Bengale
1,000
occidental.
zip codes
Et
in
on en
Western
a choisi
Bengal.
au hasard 900.
And we chose
Et dans ces 900,
900 at random.
on a envoyé à
And
tous
in the
les
900
inscrits
we
à
had
un
chosen,
réseau
we
de téléphone
sent
mobile des toutes petites
all the
vidéos très
people
courtes,
who
enregistrées
had
par ABDUL
subscribed to a
Energy,
mobile
qui
network,
est
mobile phone
une
network,
personnalité
a
reconnue,
very short video,
d'une part parce qu'il a gagné le prix Nobel,
very
d'autre
short
part parce qu'il est
recording of
le
somebody
responsable de la
famous
commission de
because he has
santé,
won the Nobel
simplement
Prize and
leur
he's also in
rappelant
charge of the
l'importance déjà
healthcare committee,
de déclarer
to
leurs
remind
symptômes
them how
à
important it was to report
à
symptoms
l'infirmière du village
to the
et
local
de porter un
nurse
masque, de
and
pratiquer la distanciation
also
sociale,
to
etc.
wear masks and
Donc,
practice
l'aspect
social
expérimental, c'est
distancing.
qu'on a
And now
laissé
the
de côté
experimental
à peu
aspect
près
lied in the
300
fact that we
codes
left
postaux laissés au
approximately
hasard, et donc les
300
vidéos ont été
zip
envoyées
codes
à 30
out.
millions de personnes
So we sent
en
videos to
laissant
30
de côté
million
pour
people,
voir si c'était
leaving
efficace ou
some
pas.
out to
Et, ce
see
qu'on a
whether
pu,
it was
et
efficient
par
or
ailleurs,
not.
l'autre aspect de
And
l'expérience,
the other
on
side
a
of
voulu voir
the
est-ce
experiment
que ce qui était dit
was the
était
following.
important.
We
Est-ce
wanted to
que
understand
au tout
whether
début de la
what was
crise du Covid, c'était en
said
mai
mattered. It
2020,
was
on
the
ne
very
savait pas
beginning of the COVID
comment
crisis. It was
présenter les
May
choses. Est-ce qu'il fallait
2020.
faire
So we did
peur
not know
aux
how
gens ou
to
est-ce qu'il fallait leur
talk
donner
to
de l'espoir?
people.
Est-ce
Was
qu'il
it
fallait
better to
insister sur
scare
les
them? Was it
effets
better to give them
individuels du
hope?
Covid
Should
ou
we
sur la
lay the
protection
emphasis on
des
the
anciens,
individual
etc.
aspect of
Et donc,
COVID,
on avait
or whether we
aussi
should lay the emphasis on protecting the
6
elderly?
différents
So
messages
we had
qui ont été
6
envoyés au
different
hasard
messages
également.
being sent
Et ce qu'on a pu
at
voir, c'est
random.
que
And
recevoir un
what we
message était
found
très
was
efficace,
that receiving the
non
message
seulement
as
sur
such
ceux
was
qui le
efficient,
recevaient, mais
not only
aussi
for the people who
sur
received
les
the
autres du
message,
village qui
but
appartenaient à
also for the
d'autres
other
réseaux de
people
téléphone et donc qui
in
n'avaient
the
pas reçu
village who
le
belonged
message
to
eux-mêmes.
different
On voit
networks,
d'énormes,
telephone networks, and did not
une
receive the
contagion en
message.
quelque
So
sorte,
there was a kind of
une contagion du
contagion.
message
The message
dans le
became
réseau social
contagious
local.
and viral and spread among the
Par
local
contre,
population.
la teneur même du
However, the
message
content of
a
the
l'air
message
d'être moins
itself did not seem to be
d'avoir
as important.
un avis sur votre téléphone vous rappelle qu'il est important de faire attention au Covid.
Simply what mattered was that they got a message saying it was important to pay attention to COVID. We also conducted a number of experiments in the US to try and develop
efficace, non seulement pour la population en général, mais en particulier pour la population africaine-américaine,
for the population in general, but the Afro-American population, especially because they seem to be hit harder by the COVID pandemic. So we conducted experiments with 10,000 subjects, 20,000 subjects. We followed the data and we followed their behavior. But we found that the results were similar. People seem to respond to the message given by doctors. They replied to the videos. They remembered the messages.
Disons, pour nous mettre en rapport avec Facebook, qui a accepté de
And
mener
we then contacted Facebook and they agreed to conduct a campaign on their own network before Thanksgiving and Christmas. So just before Thanksgiving and Christmas, the CDC, Center for Disease Control, and the government said, please refrain from traveling. I mean, if you travel, it's simply going to encourage the pandemic, and a group of physicians, women, Caucasians, women, men, Caucasians, Afro-Americans, nurses, they all recorded short videos to encourage people to stay at home, and the videos were sent in the shape of an advertising, a commercial to Facebook subscribers, and 30 million people chosen at random, so it was a randomized selection. And we could see their mobility, whether people travel less, and it seems they did travel less. And 2 weeks later, the number of COVID cases recorded by the Ministry of Health showed a decrease. So there was a lower number of reported cases simply because we had sent those videos. Obviously, we hope that non-therapeutic interventions are efficient, but we had no evidence until then, and now we do.
À propos de ces interventions incluant la technologie, est-ce que vous pensez que c'est
with these interventions, including technology, do you think that it was the gimmick side of the video, the technology that attracted people and made them listen to the video and pay attention to it and act based on the video? Or do you think it is something that is going to last in time and it will become a new way to communicate on healthcare issues, including relatively standard healthcare issues? Well, in Bengal, I believe it might be possible. The group the control group was a group that received a text, not a video. So we understand now that the video made the difference. And, in that area in Bengal, people received many messages. And so the video, seeing this video on the phone, possibly looked like a novelty, and that's why people were interested. In the Facebook project, well, Facebook sends people commercials every day, so there's nothing new about the fact that it looked like a commercial. I believe that in this case, the lever came from the fact that it was doctors and nurses speaking. And doctors and nurses are the profession that people trust most. So usually you trust your own doctor or your own nurse, but this may go beyond your own doctor or your own nurse. And seeing doctors who recorded a short message on their own mobile phone, not a very high-quality message, but very authentic, saying, please refrain from traveling around Thanksgiving, or please, stay home for Christmas and simply celebrate Christmas with your family, but don't travel anywhere else. I think that's what made it efficient. In the US, we talked a lot about reactions to COVID had become politically oriented. And this study revealed that it wasn't true. In those places where they voted massively for Trump, it was as important as it was in the areas where people voted massively for Biden. So the reason why it was politically oriented was not very much that people did not listen to the message, but simply because they had never been exposed to this kind of message. They usually live within their own bubble. I mean, we all live in our own bubble. I live in my own bubble, you live in your own bubble, and Trump's people live in their own bubble and they don't communicate with each other. So that's the main lesson here. Don't hesitate to burst the bubbles with messages, with relatively general messages. Guy, you had a question. Well, in our countries, we're increasingly concerned by the fact that social media are causing misinformation. And you're saying that in India, people were encouraged to get vaccinated? Well, not in India, in the US. It's not Facebook. It's the fact that the campaign was conducted on Facebook. I mean, there are so many things happening on Facebook, and disinformation is one of them. And it shows how powerful Facebook can be. Facebook can convey all kinds of messages. And people listen. The messages may sometimes go in the right direction, sometimes in the wrong direction. It might be misinformation. In India, the experiment showed that if an influential person says something, this may change people's behavior. So if you can say something positive that will go in the right direction, or you may also say something negative, a kind of disinformation or misinformation that will go in the wrong direction. So we're not there to judge whether Facebook is good or not good and is doing good things or bad things. It simply means that Facebook can be used to convey messages. And we can communicate in the good way on Facebook, on Twitter, and any social media, the same way that people can communicate in the wrong way by sending bad messages and disinformation. Right, so based on all this information that you've been collecting, and the conclusion of these randomized studies,
aller vers les politiques, vers les décideurs, vers les gens qui vraiment forment les politiques de santé et qui prennent les décisions. Quel est le chemin qui est le plus
are going to shape the healthcare policies and take decisions? What is for you the easiest
Là, par
way?
exemple, dans le cas de l'étude au Bengale, comme elle était
Well,
faite
regarding
en collaboration avec
the
le
Bengal
gouvernement,
study, because it was conducted in collaboration with the government, the results were immediately heard and leveraged.
Au tout début du Covid,
At the very beginning of the COVID pandemic, in May 2020, the study showed that sending Abhijit Banerjee sending messages by video was efficient means that he did it several times. There were 4 different campaigns at 4 different critical stages of the COVID pandemic. I mean, the next 3 were obviously without a study because we knew it was efficient. But we knew that all the people who belonged to the 2 main mobile phone networks in Bengal could be reached. So the connection was immediate. In other circumstances, it took a longer time between the proof of concept in an experience and the adoption, the large-scale adoption of a policy, when the policy is more complex than just sending messages. For instance, to keep talking about vaccination, lessons on a physical organization, whether we need to incentivize people. These lessons before they become a policy need to be accepted by the government. But now, for the last 15 years, we have seen huge progress and political decision makers have accepted the results of randomized trials. Nowadays, we can claim that 540 million people were directly contacted by a politician when a member of the network was able to show the efficacy in the experiment. So it shows how influential these projects can be, all in all.
Une question, chère Esther. J'ai appris, moi je suis urologue, et j'ai
I'm
appris
a
que Thomas
urologist,
Pesquet,
I'm a
dans la
doctor,
station
and I heard that Thomas Pesquet in the International Space Station was urinating in a small box that was then filtered into water that could be drunk again, because urine is 95% water. Could we develop a technology in Karachi? The 2 million people do not have drinkable water out of a 17 million population. Is it possible to make this kind of modern technology available for those who need water? Well, the question is always, do we need the most modern technology, or do we need a technology which is less sophisticated but not sufficiently disseminated so far? For instance, regarding drinkable water in Karachi, without thinking about recycling urine, there are other ideas that could have been used and have not yet been implemented. And our work consists in asking the following question: how come there are technologies that we know are efficient and have not yet been adopted? Vaccination is a very good example. Why? I mean, what are the barriers preventing people from being vaccinated? There are 25 million children not being vaccinated nowadays, and the COVID vaccination is a very good example. So, apart from the fact that new technologies are being developed, which are pushing back the limits for everybody, it's also a matter of disseminating existing technologies and identifying what the barriers, what the obstacles are that are stopping those technologies from being disseminated, be they financial, moral, etc. And we work on those issues. We try to solve those issues. Right. Well, thank you very much, Esther DUFLO, for this contribution and very interesting discussion. And well, good luck to JPAL, to your network, for the future projects. Thank you.